Good day, I'm Francis Josh Dagohoy, your student nurse for today, and I'm here to perform my evaluation checklist regarding the ear assessment. So, what is ear assessment? Ear examination is a thorough check of the ears. It is done to screen for ear problems such as hearing loss, ear pain, discharge, lumps, or objects in the ear. An ear examination can find problems in the ear canal, eardrum, and middle ear. So proceeding in the assessment, I'm going to introduce myself and explain to the client what I'm going to do, why it is necessary, and how the client can cover it. So good day ma'am, I'm Francis Josh Dagahoy from your student nurse for today, and I'm here to assess you upon your ear assessment. So I'm just asking you to sit back and relax over there because I assure you that I will do my very best to know the results in an accurate or in the best way. So after that, I'm also going to ask the client what his or her age and her name. So ma'am, may I just ask what is your name and your age?
My name is Caitlin Tagongo and I am 32 years old.
So after that is I'm going to perform hand hygiene and observe other infection control procedures. So I'm going to pump this 70% alcohol solution, which is the standard we're supposed to be used in our community, and pump it on my palms and liberally spreading it all over my hands so that the pathogens won't be able to spread during the procedure. So next is I'm going to provide privacy for the client. So in providing privacy, I'm going to make sure that the curtains are closed as well as the windows and the doors. So it is important to provide privacy because most of the time the nursing or the nurses rather roam around during the procedure or in the assessment as well as the other clients. So this helps in giving the client the trust or to in gaining trust, and also it gives them the security and as well as the what they call confidentiality if ever such circumstance may happen along the way. I am going to determine the client history of the following, but first I'm going to make sure that I have a document book so that I will be able to record all those questions and answers. So ma'am, I'm just going to ask you your history of the following. So do you have any classical symptoms of ear diseases such as deafness,
None.
um, tinnitus,
I don't have any.
otorrhea or the ear discharge, otalgia or any pain, or any vertigo? Okay, none as well. Also, do you already underwent any ear surgery? Genes, in your genes, do you have any family members that is or who is deaf? Do you have any intake of cytotoxic drugs, also known as cytotoxic chemotherapy, like gentamicin or cytotoxin, which enables to destroy infected cells and treat bacterial infections?
Never done that.
Okay. So lastly, do you have or are you exposed to any loud noises or any loud environment? Okay, thank you ma'am. The next step is that I'm going to assemble the needed equipment or materials and supplies. So the first is clean gloves, tuning fork, ruler, watch with second hand, otoscope. But since we don't have any otoscope right now, I'm going to use pen light. So otoscope is oriscope, or also known as oriscope, is a medical device which is used to look into the ears. I've already worn my clean gloves or examination gloves, so now we're going to proceed in the assessment. So the first one is I'm going to inspect for the external ear for the following. So first is the size and shape or shape appearance, and as well as the position and any presence of lesions and discolorations. So in size and shape and appearance, the ears should be of equal size and similar. So there, I'm going to also assess the position. In the position of the ear, it should be the alignment of pinna using this ruler. The alignment of pinna with corner of the eye should be in same angle. So after that, within 10% angle of vertical position as well. So, in lesions and discolorations, the skin should be smooth and without any presence of nodules, and it should be color pink. So next is I'm going to palpate the external ear. So I'm going to palpate for the ear, the tragus, the mastoid, which is located at the back of the ear, and the helix. Normal findings is that non-tender auricle and tragus. So moving on, I'm going to palpate the mastoid process for the following. So I'm going to palpate it for the tenderness, temperature, and edema or swelling, or in Tagalog, pamamaga. So in tenderness, I'm going to palpate the mastoid. Ma'am, do you feel any pain?
No.
So in tenderness, there should be no tenderness or pain when palpated. So the temperature should be warm, while the edema, or if any presence of edema, the mastoid process easily palpated or is easily palpated. So next is I'm going to inspect the auditory canal using otoscope. But since we don't have any otoscope, I'm going to use the pen light instead. So in here, I'm going to check for the cerumen, or also known as the earwax, the appearance, and tenderness. So I'm going to check now the earwax or the cerumen. So the color should be black, dark red, gray, or brown. So the consistency should be waxy, flaky, soft, or hard. And there should be no odor. The appearance should have the canal walls should be pink and uniform with tympanic membrane visible. So the tenderness should be little or no discomfort on manipulation of the pinna. In 2/3 of canal, very tender if touched with the speculum. Next is I'm going to inspect the tympanic membrane for using the pen light. So I'm going to inspect it for the following. So the color, consistency, and landmarks. So now I'm going to put on the pen light onto your ear, and I'm going to ask you to swallow. Okay. So I'm going to look this for the color should be pearly gray, shiny, and translucent, while the consistency should be intact, may show movement when swallowing. So the landmarks should have a cone of light, umbo, handle of Milius, and short process of Milius easily visualized or is easily visualized. So the Milius or hammer is a hammer-shaped small bone or ossicle of the middle ear which connects with the incus and is attached to the inner surface of the eardrum. Moving on, I'm going to assess auditory function for the following. So first is the gross hearing ability. In gross hearing ability, I'm going to whisper 1 to 2 feet behind the client. So ma'am, I'm going to ask you to cover your one ear. Betty Potter bought a bit of butter.
Betty Butter bought a bit of butter.
Next is I'm going to hold a watch 1 to 2 inches away from the client's ear. So ma'am, I'm just going to ask you to cover your one ear again. So do you hear any tick-tock?
Yes, I can hear it.
Can you cover your other ear? Do you hear any tick-tock of the clock?
Yeah, I hear it too.
Thank you. I'm going to know the lateration of sound. So first is the Weber test. In Weber test, I'm going to place activated tuning fork on center top of the client's head. So ma'am, I'm just going to put the tuning fork. So do you feel any vibration?
Yeah.
In your left ear? Do you
Yes.
feel? How about your right?
Yes.
So after the Weber test, now it is the Rin test. So in Rin test, I'm going to compare the air condition and the bone condition. So now I'm just gonna ask you, do you hear any vibration or sound?
No.
How about now?
Yes.
Okay, so in here, the AC is twice as long as the DC. So now I'm going to proceed to the last part, which is performing Romberg test. In performing Romberg test, I'm going to assess for equilibrium of the client. So by waving client, stand with feet together. I'm going to ask you to place your feet together. And after that, first with eyes open. Okay, eyes open. and then with eyes closed later. So with your eyes open, ma'am, I'm going to ask you to put your arms from sidewards. And in here, I should be at the back, and I'm going to place my hand below her hands to prevent from falling. So after that, ma'am, I'm going to ask you to close now your eyes. After that, you may now be comfortable in a comfortable position. So after that, the normal finding is that client stands straight with minimal swaying. So this is really for the equilibrium or the balance. So after that, before proceeding to the evaluation, I'm going to remove my examination gloves and perform hand hygiene. So now, the evaluation. So in evaluation, I'm going to document all the findings in the procedure using in the document book. So that ends the assessment of the ear. Thank you.